name is Alexis Grant. I am one of the co-instructors for the course, and so our agenda for today, we're going to start with some introductions, a little introduction about the course, a little bit about Washika and I and our wonderful TA Kelsey, and then we'll give an introduction about the Collaboratory for Health Justice, which is our home for the course, and Radical Public Health, who's helped develop this course over the years. And then we'll hand it over to Dr. Linda Rae Murray. And then at 6:45 about, we'll take a break, and those who are registered students for the course can stay, and those who are not are free to go. We're going to go over the syllabus for the rest of the time tonight. So a little bit about me. My name is Alexis Grant. I'm a third-year doctoral student in the Community Health Sciences Division here at the UIC School of Public Health. My research interests are on community collaboration and multi-level interventions, and thinking about how health is not just something that happens within a hospital or healthcare center. I'm really interested in all the other domains where healthy behaviors take place within the community, within schools, workplaces. And so that's really my research interests, and I'm really excited about co-teaching this class and really thinking about the ways that we see health being lived out and impacted by the policies and the people who are in charge of those policies, and thinking about how public health as a field can make a big impact in changing those policies, and hopefully we'll see a healthier world. So I'll turn over to Washika to introduce herself.
Hi, good evening. My name is Washika Tanika Torres. I'm a third-year PhD student in the Disability Studies program. So I'm in DHD, Disability and Human Development, from the South Bronx. And I actually have made a few documentaries. I do disability rights research and public speaking. And so a lot of my work currently focuses on the intersections of food justice, food insecurity, disability, and what is called foodways, which actually comes from the field of anthropology. And it looks at the culture around people's cooking methods and the meaning of those methods for different cultural groups. So what my work is exploring is what are the kind of rituals, meanings behind cooking methods that disabled people use, or food making, not just cooking, but food making methods that disabled people use, and how are those methods or processes, how are their opportunities and barriers based on people's locations, the neighborhood they live in, food deserts or types of supermarkets? Because if you are disabled, even if a supermarket is accessible to you as an able-bodied person, or if certain aspects are accessible, some may not be to other disabled people, so they might as well be living in this kind of official food desert. So I kind of want to explore those types of phenomenon with relation to disability.
So with that, I'll turn it over to Jenny Hebert Byrne to share a little bit about the Collaboratory for Health Justice, who is hosting this class for the first time this year.
Thanks, Alexis. Can you hear me?
Yes.
Okay, thanks, Washika. And I'm Jenny Byrne. I'm an associate professor in the Division of Community Health Sciences in the School of Public Health at UIC. And I'm in an interim position with this new center in our school called the Collaboratory for Health Justice. So I'm the interim associate dean for community engagement, and helping with Alexis and Maggie Acosta, who's also on this call, to help build this space in the school that helps us to engage with community partners in our research, our teaching, and our practice. And so, as Alexis said, this course, Epidemics of Injustice, which has been developed by Radical Public Health, which Kelsey Arnold is going to talk about in a second, is going to live in our space in the Collaboratory for Health Justice because we really commit to community engaged teaching, which means opening up our classrooms as much as possible, both to speakers who are not professors, and also opening up our course learning to our community partners. So we're just really thrilled to have so many of you join us, and we hope that you join us every week. The Radical Public Health students and Washika and Alexis have done a amazing job identifying provocative speakers, and we just feel really lucky to have you all here. So I'll turn it over to Kelsey.
Hi, everyone. Yeah, so I am Kelsey Arnold, and I'll be the TA for the class this year. And I wanted to give you a little bit of information about Radical Public Health. So like has been mentioned, this organization was central to bringing about this course into existence 3 years ago. And it's a group that seeks to address the root cause of public health issues and then explore radical solutions to those injustices. And it's open to anyone. So it's made up of students, alumni, faculty, staff, especially now that we're virtual, we welcome anyone to participate. And I've listed here some of the current committees that we have that's part of this group. And that includes Epidemics of Injustice committee that made this course possible. There's also an Abolition, COVID-19, and Outreach committee. And we generally meet on the first Thursday of every month at 7 p.m. Although this may change if it's too much with this course also being on Thursdays. But you are welcome to join in on our next meeting, which will be February 4th. And I included our contact info if you want to get on the email list or learn anything more. And then on the next slide, you're going to see some information about the information sessions we have coming up, or one already passed, but the one on the 20th is still available, and that's a good opportunity to learn more about our RPH and the committees we have. If you're interested in being involved, we'd love to have you.
Thanks, Kelsey.
Thanks.
So now I'm ready to turn over to Dr. Linda Rae Murray. Just a little bit about her. If you haven't heard her speak before, she's just an amazing person who has so much, she has a lot of thought behind her practice. She spent her career serving the medically underserved. She has worked in a variety of settings, including the medical director of the federally funded health center, Winfield Moody, which served Cabrini Green Public Housing Project here in Chicago, the residency director for occupational medicine at Meharry Medical College, and bureau chief at the Chicago Department of Health under Mayor Harold Washington. Currently, Dr. Murray is the Chief Medical Officer for the Cook County Department of Public Health. She practices as a general internist at Woodlawn Health Center and is an attending physician in the Division of Occupational and Environmental Medicine at Cook County Hospital, and is an adjunct assistant professor at the UIC School of Public Health in the Occupational and Environmental Health Sciences and the Health Policy and Administration divisions. She also plays a leadership role in many organizations, including the National Association of City and County Health Officials, Health Equity and Social Justice Team, the National Executive Board of the American Public Health Association, and serves on the board of the Chicago-based Health and Medicine Research Policy Group. In 2011, Dr. Murray served as president of the American Public Health Association, and she's the co-chair for the Urban Health Program Community Advisory Committee at UIC. Dr. Murray has been a voice for social justice and healthcare as a basic human right for over 40 years, and she remains passionate about increasing the number of Black and Latino health professionals. So with that, I will turn it over to Dr. Linda Rae Murray.
Thank you so much. And you have to let me share though.
Try now.
That's okay. And I just want to say that I have been thankfully retired from seeing patients in county since 2014. Well, almost. So for which I am grateful because we have a global pandemic going on. So this is a big group. This is a great class. I want to do a shout out for Radical Public Health. And one of the major things that organization was first formed around was curriculum reform, revision, and they've been doing a great job. This is just one of their products. So if you're interested, please join. The second thing I want to say is that one of the great things about this course is that it's open to everyone, community people, anyone on campus. And so I'm going to open this year's course focusing on public health. And I will try to, for people that are not in public health, I will try to give you a little bit of our jargon because I want us to think thoughtfully about what's going on in public health and what we need to be doing. Now, I didn't plan to do this particular lecture, as you'll be able to tell from the slides, but weird stuff happened this week. Well, actually, it wasn't that weird, which is my whole point. But in my mind, everything that happens in this country is related to public health. And so one of the things as public health professionals that we need to ask ourselves when we see something on the news or we have a problem, we need to say, how is this related to our field of work? And what should we be doing that we're not doing? Or what should we change that we are doing that would help improve this problem? So because I'm retired, I can have the TV on all the time and listen to all these great remarks in Congress, as the hearings and the arguments. And one of the refrains that happened in the press, in the newspapers, in the evening news is that the attempted coup that we saw in DC, this is not us. That's what people always say. This is not America. I'm so shocked. And I'm like, no, this is us. Okay, so one of the things I want to challenge just everybody about, if you saw what happened this week and thought that this was not America or that you were surprised by it, we need to step back and be thoughtful about what our history really is and why I do think this is us. It's certainly true that the Confederate flag wasn't in the Capitol, they tell me, even during the Civil War. This noose was out, as you can see, in the reflecting pool. I think this is typical America, and I certainly wasn't surprised. I'm not going to read this to you. I think it's important that we acknowledge that we are meeting on stolen land. This, on the other hand, is a great flyer. This was a flyer that went out before the 6th. One of the amazing things to me, now I don't troll the social media. I don't try to follow right-wing conspiracy theorists. That's not what I do. But even I was aware that they were planning a big event on January 6th. I mean, you could just be minding your own business, and how could you not know that they were doing this? And I love that they quote Lincoln and they quote Martin Luther King, they quote lots of people. So to think that this was not pre-planned, premeditated, organized, I don't know how many of you have been involved in organizing demonstrations, and I've been involved in a lot of them. It takes a lot of money, planning, and coordination to bring that many people to DC for any event. And so I won't waste time with how much help they had and all that kind of stuff. I'll let the other people do this. But the point is, this kind of activity should not have been a surprise. I'll remind you that there have been efforts to take over state capitals, especially poor Michigan. So this is not that unusual. It was a big event. The Democrats are all upset. We ended up with 5 people dead, some 50 policemen injured, which I find ironic for an audience that is so supposed to be theoretically so pro-police. And as you know by now, President Trump was impeached again. So let me start by reminding us that this is all taking place in the midst of a global pandemic. If you haven't read the novelist Roy's comment here, please take your time. These slides will be distributed, and go back and read it. And she has a novelist and has beautiful language. And what she's really saying is pandemics represent an opportunity, and always have represented an opportunity for society to reflect on what they're doing, how they're structured and organized, and to reorganize things. That's always happened with pandemics. We almost don't notice them. I'm even retired. My career as a physician has been marked by these pandemics. The most significant one has been and remains right now the HIV pandemic. And I think there's a lot of lessons for us to learn about that. So I want to start with just for a moment, I'm going to start it in with personal reflections, because I'll make obvious my biases and my political positions. But what I'm really encouraging you to do as you go through this course and as you go through your normal studies, and especially if you're fortunate enough to be finished with school, as you go through your normal thinking, is to think and read and be thoughtful. So this is what I thought of as I sat there watching the people run through the Capitol, just for my personal life, not necessarily the most important stuff. I was born by coincidence in 1948, which is where many historians mark the beginning of the modern civil rights movement from 1948 to 1968. So I grew up as a child and a young adolescent and a college student in that modern civil rights movement. I remember as a child getting under my desk as we practiced what would happen if Russia dropped nuclear bombs on us. And I remember as a young child saying, this is really stupid. I really don't think this desk is going to help me out. But we did that for years. I was very young when Brown versus Board of Education decision was let out. But I remember as a child knowing that the Supreme Court did something big that was supposed to help us Negroes. I knew that. That was clear in my family. I remember seeing in Jet magazine as a child and being horrified by the picture of Emmett Till laid out in his coffin in Jet magazine. So you can see the ones in red, I think, are positive things that are movement issues that happened, but assassinations were normal. It's easy to forget today, but I can't even list them all here. But certainly the big ones of the Kennedys and Malcolm X and Dr. King, Medgar Evers, but also the attacks, the vicious attacks against activists, the Orangeburg Massacre, Kent State. I'm part of, this is where I cut my teeth on these movements, the American Indian movement, Black Power movement, Chicano movement, Puerto Rican independence movements. The modern environmental movement started in '70. The anti-Vietnam movement is a critical part of my upbringing, and all these other things. And Nixon resigning, he didn't get impeached or anything like that, but actually we were able to get him out of office. I sat there and watched on TV while people died and drowned during the Katrina hurricane, which was an amazing notion. Flint, Michigan, the Dakota Access, all these things, and you will be adding these things too in your career, in your lifespan. So I would say, without knowing any history, without reading one history book, you could not sit there and say that the craziness that happened in DC is not typically American. Hopefully, most of you who are public health students have seen this before. I really put this in here for people that aren't in public health. This is our little jargon, but I also think it says something that I want to help us think about. This is what we call an ecosocial model. This happens to be from the World Health Organization. And this is how most people in public health in the world, not everybody, but most people in public health in the world think this is a model that makes sense. And the main thing I want to say here before I quickly move on is that today, especially with COVID, there's a lot of talk about the social determinants of health. That's that little blue box there that are really intermediary factors. And I want you to pay attention to these structural determinants. So when we talk about racism and structural racism, we're not talking about stuff in that blue box. We're talking about stuff in this orange and yellow section. What kind of government do we have? What kind of economic policies? How do we structure power? I'm going to be throwing out, I won't spend a lot of time because you can get these slides afterwards. I'm going to be throwing out a number of books to read. I could spend the whole hour just going through book after book after book. We don't have time for that. So I want to say you can't understand the United States without understanding something about North America. This is one easy to read, quick book. There are many others. And then Paul Ortiz's book tries to tie together African American and Latinx history in the early part of this country. Two excellent books. So Sister Kamara Jones, a physician and epidemiologist, has a wonderful way of talking about racism and making clear what it is. Her definition is fine for us for this moment. There are three critical components. It's an ideological structure that advantages some people. That's very important. Advantages some people, white people. It disadvantages other people. And it saps the whole society of strength that it needs to function. And structural racism is really, I think, the mold, the baking dish, the muffin pan on which everything else we do in this country is baked. So structural racism is the structures that we put in place so that you don't have to think about being racist. It happens automatically. It's baked into the structure, and you have to think about being anti-racist. So this notion is American as apple pie. I believe, not everyone agrees with me, but I believe that the development of racism and capitalism are linked. And so you have to address structural racism by thinking about capitalism. I believe that here, this is more common agreement, that anti-Black racism plays a special role in the world and certainly in the United States. But for this country, we need to remember that racism is not binary. That is to say, people of color really does have some meaning. It has unique meaning for different groups, but the racism that this country expresses every day is not limited to anti-Black racism. It includes all people of color and indigenous people. We don't have time to talk about this, but I want to remind you that who's white in the country changes by time and place. That's another whole discussion. So here's a definition of racial capitalism that comes to us from Du Bois, who I think, and I'm going to have a picture of his book in a minute, but I really think he is one of the clearest thinkers in American history, period. And he really begins to develop this concept of racial capitalism in Black Reconstruction. So he argues here that Black labor is the foundation, not only of the Southern economy, but of the Northern economy. And so you can't understand the development of capitalism in the United States, and equally as important in the world, without understanding racism. And so this concept of racial capitalism is not something that we talk about very often, but I think it's foundational. The other thing that I want to say, and this is important for all of us in healthcare, whether you're in disability studies, nursing, pharmacy, public health, this is critical to understand. Medical science, and I'm being clear here, I'm talking about medical science, I'm not talking about medical religion, especially American medicine, has been foundational for the ideology of racism in the world. In fact, when the Nazis were fleshing out their racist policies, they went to the United States for the way to do it, and they thought we were a little bit too extreme, so they sort of softened pieces of it. I had this up here because I'm going to be talking about really depressing stuff most of the night, but I want you to know I am aware that people fight back. They fight back all the time, and sometimes we win some victories. So this is just a list of slave revolts. So, but even though I'm going to be focusing on massacres and other things that happen in this country. So I'm going to take a second with these books. I've already told you that I think that Black Reconstruction, which is Du Bois's best work, in my opinion, is foundational. In fact, when Trump was elected in 2016, that very night when I was sitting there watching him likely win, I said, I have to go back and read Black Reconstruction and Nell Painter's book, The History of White People. So you have to start there. How can you talk about racism if you don't understand where white people came from and how they think and how they developed, and you don't understand what happened in this country? There's another book there, Blackman's book is excellent, Slavery by Another Name. So this notion of being upset about a political outcome, okay, so you have a group of people, even before we voted in November, who said it's impossible for Trump to lose the election. And these people believe this. And even when he lost the election, again, not simply in the Electoral College, but also in the popular vote, as he lost the last time he ran, you have millions of Americans, many of them well-educated, saying that is impossible. We can't prove there's widespread fraud, but there must be widespread fraud. So ask yourself why they think that. And don't think of Trump when you do that. You know, because if you think of him, he clearly has some mental health problems. But ask yourself, how is it possible that people really believe that? I think it's entirely consistent for Americans to believe that, because they really believe in racism and white supremacy hierarchy. They may not use that language. They may think that they're not racist. They may not, some of them, you know, may never have the Confederate flag running around with them. But what they're saying is, it's not possible for real Americans like me to have elected this man. And we'll talk about who voted for him a little bit later on. So this is one example, a Memphis massacre, just some. Again, you could almost open a history book and look at this. This is a massacre that had happened in 1866. And this is a pattern that we see throughout the United States, not just in the South, but throughout the United States. And so this is a situation where in Memphis, some incident happens and white people go crazy. And so you can see here that there were how many hundreds of people were injured, 100 homes were burned down, no arrests were made. Okay. You can ask yourself what might have happened in the Capitol if they had actually gotten through a little faster. Here's the Massacre of New Orleans in 1866. Now, don't forget, in this time period, we're in Reconstruction, which means Black men have the right to vote. And they are voting and electing Blacks in local jurisdictions, as well as electing people to Congress. There was a Black senator from Mississippi whose name I forget at the moment, and a number of Black Congress people. I think I have a picture from later on. So again, this is an instance where you have a government duly elected, but you have the Democratic Party of whites joining with white supremacists to just have a riot and take over. And so this was a riot in New Orleans. The federal troops were still there, and so they didn't completely take over, but they did have a huge massacre of people. Again, the Colfax Massacre in 1873, you can read there a little bit, 300 armed white men. That's a lot of people even today, much less in 1873. From the Ku Klux Klan and other places, they were contesting the right of Blacks to vote. They were contesting the right of Blacks to have citizenship rights. Just like Trump is saying, it's not possible for me to have lost Georgia if you had only let the right people vote. You let people vote who are fraudulent. It's not that the votes were fraudulent in their minds. It's that the people casting the votes were fraudulent. Why do you have those Asians voting? Why do you have those Mexican Americans voting? Why do you have those Black people voting? They're not real Americans. Their votes can't count. So in this particular case, again, in Colfax, the Republicans tried to hold up. They were basically attacked by a mob. I shouldn't say a mob, a militia, an armed militia. And that's what happened in DC, by the way. It's a mistake to call them a mob. Some portions, not everybody, obviously, some portions of that people came there ready. They came there with their guns. They knew what they were going to do. They were planned. So in any case, in this particular instance, the Black and Republican people hold up. The militia, the white supremacist militia, defeated them. People surrendered, and then they just went ahead and slaughtered people who had already surrendered. Federal charges were brought against these folks. Again, this is 1873. But you see here the Supreme Court ruled that the 14th Amendment didn't apply in this instance, the inability to vote. It only applied to state actions, and so there was no protection. Again, some books, let me just take a few seconds with here. This first 2-volume book, if you have any interest in Black health history, this is the seminal book on that. If you don't want to read 2 volumes, David McBride, who is a real historian, this is an excellent 1 volume, much shorter. Public health, you know, from TV to AIDS book. If you think about where National Public Health Week comes from, that we go through, I think every April, it comes from the movement for health among Black people, and David McBride documents that portion of history. So there's some other books. Here are the federal representatives in the Senate and Congress that were elected as Black men got the franchise. And this brings us to, I want to spend a little bit of time on here. This is like a civics lesson. And I don't, and you know, I'm old, and it's a long time since I read civics. But I do remember as a high school student taking American history, I do remember this famous Haze Compromise. Hopefully you remember it too. But it does us well to think carefully about it, because there are a bunch of lessons here. So again, this was the election of 1877. I thought of it because Senator Ted Cruz had the nerve to mention it in his speech, arguing for not confirming Biden as the president-elect. And he refers to the election of 1877, and he argues that the Congress should do today what they did in 1877. And since he very well might be running for president, and indeed may one day be our president, I thought it useful that we spend a little bit of time on this. So Rutherford B Hayes was a Republican. Again, I want to remind you, this is 1877. Republican is the party of Lincoln. They freed the slaves. He was a officer in the Union Army. He was an abolitionist and supposedly a reformer. Tilden, who he was Democratic candidate, was also supposed to be an abolitionist. And basically what happened is the election was close. In the early stages, it appeared as though Tilden had the popular vote, that Tilden had won the popular vote. And you can see here that the Tilden supporters, the Democratic supporters, were very upset that Hayes might get named as president. You can see a peaceful army of 100,000 men marched to Washington. I don't know how peaceful it was. You see the gun there in the little cartoon. But this was the Democratic Party aligning themselves with the white supremacists of the Confederacy. So here's the situation. The states that were in, there were 4 states. I don't want to talk about Oregon. That was a minor thing with 1 vote, but the critical states were Louisiana, Florida, and South Carolina. These states, it was, quote, too close to call. And if you believe some people, the Democrats won. And so what happened here was you had a group of electors that represented the Republicans and a group that represented the Democrats that got presented to Congress. So they had to decide who were they going to believe. Again, this is during Reconstruction. So as this election was going on, especially in South Carolina, they were out there with guns, shooting Black people, killing Black men. They were this is called suppressing the vote. We don't usually use bullets nowadays, but that's what they did. Everyone agrees that if the election had been open, that Hayes would have won all 3 of these states because you had huge numbers of Black, newly emancipated slaves voting Republican. But there was such voter suppression that these 3 states were considered toss-ups. And so what happened is, this is what our buddy Cruz wanted to do. What happened is they set up a special commission to consider who to give the election to. And we don't have good documents, but basically what happened was a famous Haze Compromise. The Democrats agreed to not contest Hayes's election, the election of the Republican president, if he promised basically to withdraw troops, the Union troops, from the Confederacy. So now let's think for a minute about this whole structure of what that means. This is still during Reconstruction. Theoretically, the Confederate Army has been defeated. We can quibble about how. So when we talk about unity, as people are talking about now, think about what this meant in 1877. Okay. So we don't want to have a second civil war, was the cry. Let's agree to withdraw the federal troops, even though it wasn't a mystery what was going to happen if that happened. And think for a minute with me, just structurally. Let's go back to Civics 101. What does it mean as we set up in our Constitution, in our government, a way to deal with the Civil War? I want to remind all of you that people who were enslaved were counted as 3/5 of a person. Remember that in the Constitution. After the Civil War and after the Civil War amendments are passed, we're no longer counted as 3/5 of a person. We're counted as a full person. So now you have the portion of the country, the South, who were traitors and tried to secede from the Union and get militarily defeated. And now all of a sudden they come back into the Union with more power because they have more population than they had when they left. So really what the Civil War did, it increased the number of Southerners who were allowed to function in the House of Representatives. Why? Because they were counting the ex-slaves as full human beings. Now, the Republicans weren't completely stupid. They put a little caveat in the amendment that said, if y'all don't let Black people vote, we're taking away some of these representatives. But they didn't do that. They didn't take it away. They were so busy in keeping the peace. And I'm not sure they really, except for short-term elections, cared much whether people voted. So this solidified, it didn't unleash, it solidified domestic terrorism in the United States, causing the migration, the fleeing of probably 6 to 8 million Blacks over the next several decades out of the South. And by the way, also solidified other kinds of terrorism that we'll touch on really quickly. I put this book here, Wilmington's Lie. This is a well-written book. It's something you can read quickly. So in 1898, this is the real coup. This was an attempted coup last week. In 1898, we had a real coup in the United States in Wilmington. And at that point in 1898 in Wilmington, you had a Republican Party that was integrated, a biracial, a party made up of Blacks and whites, integrated, running large portions of the state and running the city of Wilmington. And if you take time, you can read about their positions on things. And these red shirts, they're called here at the bottom, decided that they were going to take over Wilmington. The top picture is a Black newspaper that they burned down, and they basically gathered an army, organized an army with Democratic Party support, organized an army under the leadership of the red shirts and other white supremacist organizations, and literally ran the Black Republicans out of town, killing many of them, and took over the city without getting elected or anything. So this was actually a real successful coup. Here's an idea of the kind of propaganda that existed in the day. This happens to be from a neighboring county in North Carolina. But people, this fear of Negro rule was really what was used throughout the South and the rest of the country to try to disenfranchise Black men. I'm just going to go through this really fast because I want you to know, I just want to point out to you, this is from a Howard Zinn project. The URL is down there. You can go to the site yourself and look at this stuff. I didn't pick everything. I just picked a few things. This is just a list of massacres. And I just picked some representative ones. I already mentioned Orangeburg. Again, trying to desegregate a bowling alley in Orangeburg in 1968. I was in college when this happened. This is before Kent State. And they just shot a bunch of Black students in the back. And these 3 gentlemen here were killed. 1937, right here in Chicago, the U.S. Steel Strike Memorial Day Massacre. So they didn't just massacre Black people, labor organizers, etc. The Ponce Massacre in Puerto Rico. Hopefully you've heard about the Tulsa Massacre. I hope you have. You should look it up if you haven't. And you can, the Red Summer in Chicago. This is a massacre of 15 Mexican Americans killed by the Texas Rangers. If you read some history about the Rangers, in police violence against Mexican Americans and Native Americans. So I'm just going, Wounded Knee, the infamous Wounded Knee. And I just stopped here at 1637, the massacre by the Puritans. So we have a long history in this country of racial violence. We have a long history in this country of racialized discrimination. I didn't put in anything right now about Asian Americans or, but you can pick any group. And this history is present today. This picture of these gentlemen being lynched are Mexican Americans who were lynched at the same rates, in the same proportions as Black Americans during the same decades, the post-Reconstruction period. And this same logic is what we use today when we look at our ICE detention centers and separating children from their parents. It's the same process. We don't have time in this lecture to talk about Why is it so many people are trying to immigrate into our country? It's the same process. It's the same reason Blacks fled the South. We create conditions of injustice and terror, and people cannot live, and they try to flee. So in our models, and when we talk about the ecosocial models of disease, we have to include oppression. It's not just enough to talk about power. We have to include oppression. When you have injustice, what you're really saying is that someone is being oppressed, and equally as important, someone is participating in the oppression. And I was pleased this summer to see a reaction from all over the country, including many parts of the country that are predominantly white, to George Floyd's murder. But I want to remind you, this is not a surprise to Black people, certainly. It's not a surprise to people that are oppressed. The fact that we now have it on tape and it can be streamed live, that's some new technology, but this is not a surprise. And so it's not an accident, as we can see in the bottom picture, that groups of people oppressed around the world, like the Palestinians, react to this. Here's somebody that I'm not sure that you have read. You should read him, Frantz Fanon. He's a psychiatrist, participated in the Algerian Revolution. But he has an interesting quote there, as you can see. And he really talks about the oppressed being violent. So I want to be clear that there's a difference between the violence of people who were oppressed and the violence of the oppressor. We can discuss that and debate that later. This march here took place in 1917. Okay. Oh, sorry about that. I was trying to move my little, here we go. So now think about this. I think this would be a big deal today, but this is 1917. The newspaper said between 8,000 and 15,000 Blacks in New York City. Okay. That's a lot of people today. They were marching because in East St. Louis, Blacks had been beaten up and killed by white mobs. So they were protesting that, 1917. The march was led by these women and children dressed in white and followed by men dressed in Black. It was a silent march. And lining the streets, not participating in the march, was an equal number of Black observers. So think about what it means in 1917 to have 15,000 Black people march quietly in New York City. This slide is a little hard to read. I'm going to help you a little bit. So when we talk about what's going on in our country today, this is just some of the major federal level amendments and acts that try to address injustice. It starts off in 1865 and going through the 13th, 14th, and 15th Amendments. Okay. I love this next series. 1870, the first KKK Act for Civil Rights of 1870. Then you had the second KKK Act for Civil Rights of 1871. And before the year was over, you had a third KKK Act for Civil Rights of 1871. Okay, that's even before the troops are gone now. The Civil Rights Act of 1875. The Civil Rights Act of 1957. Notice that big gap. That's what happens when you end chattel slavery. Reverend Barber talks about this. When you have progress being made by Native Americans or Mexican Americans, when you have progress being made, then there's a pushback against that progress by people that rule the country, and they convince other people that the problem rests with people of color. So you have that big gap between 1875 and 1957. Civil Rights Act of 1960, the Civil Rights Act of 1964, the Voting Rights Act of 1965, we still have voter suppression. We have more voter suppression today than we certainly had in the 70s. The Civil Rights Act of 1968, 1970, 1982, 1987. Do I have to go on? And we still actually are in worse shape than we were certainly in the late 60s in terms of protection of the vote, reproductive rights, a whole range of other things. So just because we make some progress, never think that that progress is guaranteed, because there's usually a reaction to the progress. This is from Chicago, the rebellions after Dr. King's death. Again, I was a college student at University of Chicago when this happened, and I remember these nights as they announced his assassination. Here's there were movements around reproductive rights in this period. These happened to be the Brown Berets, a group of Chicana women, or maybe these were Puerto Ricans, I'm sorry. Here's some other books. You can look at them later, a whole range of different books involving different groups, but all of them involved with public health. And I want to take a minute here before we conclude. This is a new series that Nancy Krieger is putting out as the key editor behind it. The first two, Political Sociology and Climate Change, are already out. And Jaime Burrell's book, excellent book, I'm so looking forward to it, will be coming out. You can get it on Kindle now, but it'll be coming out at the end of the month. So these are books you should be reading if you're in public health. You should be asking yourself, what are we doing right and what are we doing wrong? You know, we have a pandemic and we're responding to it in a worse way than we were before. Now, just so we don't get all cocky here, I'm going to go through this quick, but the red arrows mean people voted for Trump and voted in greater numbers for Trump. The blue arrows mean there was a trend toward Biden. Let me be clear. This is Chicago. We're a Democratic town. Okay, Biden won overwhelmingly. So don't get confused here. These are microscopic changes. That just means more people voted for Trump than 2016. That's what these mean. But look at this and ask yourself, are we thinking about things correctly? So this is Cook County. These are all numbers for Cook County. It's a big shift for Trump. Here's a Latinx awards and zip codes that had a big a move toward Trump. Skokie, Evanston, largely immigrant, different kind of immigrants, South Asian, Eastern European immigrants, a large move toward Trump. Chinatown, same thing. This is the Black community, a movement toward Trump. More Black men voted for Trump this year, 2020, than in 2016 by percent. More Black women voted for Trump. Obviously, he got a small number. But here's a summary. This, even though it says Chicago, it's really Cook County. So Trump went up by 49% in Cook County, and Biden only went up compared to Hillary by 2%. Again, Biden won overwhelmingly. So we have to have a more nuanced analysis of what's going on. So when we look at COVID and we think about it, it's not just enough just to count the numbers. Public health people should be shaking in our boots because this is from Hopkins and not CDC. Our medical system is in trouble, even if the ICUs aren't full. The American Hospital Association says hospitals are losing $50 billion a month. We had the problem of Mercy closing, which is not a COVID problem. It was in danger of closing before COVID, but all these things make things worse. U of I, County, Rush, University of Chicago, they don't publicize. All of them are doing some layoffs, quiet layoffs. There was just something on the news, which I'm hearing, you have physicians graduating from their residencies. That is to say, they finished them in June 30th, and they can't find full-time jobs. Why? Because these hospitals are in trouble, because they're not making as much money off of COVID as they make off of the usual things. So the usual market stuff are disrupted. I hope you know the mortality rates for COVID. I won't tarry too much on them. They're disproportionately people of color. These are national rates. We do not have a medical care system that is functional. Our public health system, I hate to even call a system, that's crumbled in my career completely. But this is just a map. Half of the counties in the United States don't have one ICU bed. We do not have an adequate medical care system. We're worried about getting the vaccine out. Everybody's talking oh, it's in storage. We don't have what we need to vaccinate people. In 1947, there was one case of smallpox in New York City. They vaccinated 6.3 million New Yorkers in 2 weeks. There's not a place in the country that could replicate that today. We know that COVID is hitting the jails and prisons. We can't get people to move to release people from the jails and prisons. You should look in the literature. Again, I don't have time to cover it all. We can document the horrible impact having the jails and prisons without the care that they need and having too many people in them, how that makes the pandemic worse. 40% of the deaths are going on in nursing homes. Again, not a surprise. We should have been there from the beginning. Let's look at some local data real quick. This goes up and down. It can change. We haven't, it's too early for our holiday surge. I'm really worried about that. We'll see what happens. But these are on the city's website, so you can look these up. So you know this, the data is the same for the city as nationally. Different groups have different rankings. For example, on the West Coast in the Bay Area, Asians have the highest rate of mortality, age-adjusted mortality, because they populate the service industry so much there in the Bay Area. But you can see the same kind of thing here. This is a hotspot analysis. So this shifts when we have a debate about should schools be open or not. Don't talk to me about what the rate is in the state or what the rate is in the county. We have hotspots here in the city. So we need to really have a finer tuned notion of how to keep track of what's going on with the pandemic. We don't have enough of data like this, but we do have some data on where outbreaks are occurring. So we have to set that up. So if we're going to open up the schools again, then we better be able to know when outbreaks are happening. And you've already heard in the press, we've had one outbreak already and they've just been open a week. Here it is by the same kind of information by industry subtype. But this is how you deal with the pandemic. Okay. And if you don't have people that have this data and have it easily, we're in trouble. Chicago has a good health department, a big health department. Again, only 27% of all the county and local health departments in the country have an epidemiologist on staff. So we really don't have a public health infrastructure. We've had some stimulus money, but it's gone to the big businesses. Very little has gone to individual people and families or small businesses. In Germany, I have a niece that's living in Germany. They got 90% of their income when they had COVID outbreaks and when they asked people to stay home, 90% automatically from the government. Then it becomes possible to stay home. So people are reacting to this. Here's some people from the American Indian movement toppling Christopher Columbus and Dr. Sims, the father of OB-GYN, who did all those experiments on Black women without anesthesia, taking down his statue. So we win some victories, but here's where we are. We haven't done this in public health students. We all say glibly, racism is a social category, but that's only something we say and social scientists say. That's not something most Americans know or understand. It's not something even most doctors know or understand. So this is a study that was done, and we've done studies. We know, for example, that Black kids will get less anesthesia in the emergency room than white kids. Mexican-American kids, even with a long bone fracture, that's one of the big fractures in the leg that comes through the skin. So you don't even have to worry about what the diagnosis is, get less anesthesia. So here are some reasons why. I missed these lectures in medical school, so this must come from somewhere else. Blacks age more slowly than whites. That first column is what the general public thinks in this study that they did, 92 people. The second, third, fourth columns, those are what medical students and residents think. So these are people that have more science training than most people, and they're already completed 1, 2, or 3 years of medical school, or they're already physicians. So you look at almost a quarter, 21%, 28% think Blacks age more slowly, that our nerve endings are less sensitive. In other words, we can take more pain. So if you think we can take more pain, it would make sense that we would get less anesthesia and that we're just drug seeking because we're all addicts. That our blood clots more quickly. Now it's interesting that nobody thinks we have larger brains. That was a little interesting. So you can read here and see that for yourself. The skin is thicker. 40% of first-year medical students thought the skin was thicker in Black people. So are we really surprised that white cops think that Black children are a threat to their lives? If you think that we're animals, if you think that we are not human, we are subhuman. I want to take a few minutes on COVID hesitancy. Again, just because people are hesitant about vaccine doesn't mean they're all hesitant for the same reason. So this is from Kaiser. You can go look it up. They've done this at least 2 or 3 times now. I'm sure they'll continue to do it. Republicans are more vaccine hesitant than Democrats, but you see Black adults are 35%. This is probably more important. We can see movement. This is from September to December. So all groups are becoming more comfortable with vaccines. So you can see that Blacks still have the lowest rate of acceptance. And this is some more detailed look at that about what percent, why people don't trust the vaccines. So Black and Latino folks know, they don't believe, they know that nobody did this vaccine with us in mind. That's really what they're saying. I don't trust white folks. I know they wasn't thinking about us when they were doing this, so I'm gonna wait and see. And that's what a lot of people are doing. So let me end here with just some comments and more books. Read widely. These 2 books have nothing to do with health or public health. One of them has to do with the slaves running away to Mexico, and one of them has to do with our general imperial nature. Read widely. Don't be afraid when you're asking questions to read widely. And we have to really implement this stuff. We're not just interested in bicycle paths. That's important. Or quit smoking campaigns. That's important. But if you don't tie those issues back to their structural roots, we're not going to make any progress. So these are the policy changes that we know we need to make. I'll just go through them quickly. They're not new. We've been trying to fight for them forever. This makes me very nervous. I'm a single payer supporter. Single payer Medicare for all is a mild reform. It is to the right of Richard Nixon. See, when you're old like me, you get to remember. I remember when Richard Nixon announced his national health insurance plan, all of us said, oh, that's so reactionary. We're not supporting that at all. But believe me, that was better than what we got now with the Affordable Care Act. But if you can't make Medicare for all enacted in the first 100 days, then you're not serious about addressing COVID. So we know what it takes. This is where I grew up, Cleveland, Ohio in 1966. I was 18 years old during these rebellions around police brutality, and the National Guard, pointed a rifle at me. I was there. I remember these people. This is here in Chicago, in Humboldt Park. And I think I've shown some of you this before. This is in Mount Greenwood, the only part of the city that voted for Trump in 2016. And there on the ground in the foreground is my youngest granddaughter, in the streets fighting the same battle for the same demand that I did in 1966, that people did in 1950 or 1920 or 1898. There's a pattern here. And so what should we be doing? This is from Northwestern. These are the things we need to do. Learn some history. Start with the history of your field. Start there. Read about racism. Try to understand how it functions. Understand the American medical system and health system. So you have to do some work and read and be able to think about things differently and to fight for things differently. I want to end with this. I think there's one slide after this, but this is the most important slide. This is Dr. Jones talks about this. I might add a few other things, but let me just say, she argues that these values that are American values are what is holding us back. We narrowly focus on the individual. We don't think about populations and groups. We have an ahistorical stance. That means we don't care about history. That's what I've been emphasizing. So you have to understand history. We support a white supremacist ideology. There is a myth of American exceptionalism. We are not an exceptional nation. We are not the best nation in the world. We're not the greatest thing since sliced bread. We have a myth of meritocracy. Nothing in this country has ever been organized around who is the most meritorious. There's a myth of a zero-sum game. If you get something, I have to lose something. And we can't think beyond today. We don't think, what does this mean for my great-grandchildren or my great-great? We can only think for people we can see. That's all we can manage. She argues that these American values are what is crippling our nation. And so I will end with King's quote, one of my favorite quotes. Rarely do we find men who are willing to engage in hard, solid thinking. There's an almost universal quest for easy answers and half-baked solutions. Nothing pains some people more than having to think. You all are going to be professionals in whatever field you've chosen. You have an obligation as a living, breathing human being to think and to think of for solutions and to be willing to work hard and fight for what you believe in. So let me stop there. I probably ran over. I apologize. And if anyone wants to disagree, which no one does, but I love it if you disagree with me. But if you have questions or comments or other points of view, that'd be great.
Thank you so much. That was amazing, as always. Every time I hear you talk, I'm just amazed at how much knowledge you have. We do have a couple questions that were dropped in the chat, so we'll take maybe about 10 minutes and answer whatever we can, and then we'll go to our break. So a couple of folks asked, what can public health people, what can clinicians do to actually change the structural determinants of health and reduce the effects of systemic racism?
So let me answer that in an honest way. So first, and even though, let me speak as a physician, even though, for example, physicians have lots of privilege and status, relatively speaking, what any individual can do to address the structural changes are things we do as basic human beings and people struggling to have citizenship and human rights. So, the normal things that sound bad, that sound like mundane, like vote, etc. But every one of us, to the extent that we have some specialized knowledge, whether we're a kindergarten teacher, whether we're a carpenter, whether we're a nurse practitioner, whatever, we can connect our particular area of knowledge and expertise, what we do every day. We can connect that up with these structural factors. We can remind people and explain to people the structural conditions. And this is not as hard as you think. If you have time, and certainly for some of us, for example, if you have some authority in terms of worker training and stuff, if you have time, you can explain to people, why is it that Blacks don't own as many homes as whites? You can explain that to people if you know the history of how that came to be. And so that's why the policy of studying history and understanding it and making these connections, it allows you, when you talk to people, to make the connections with folks and to help them understand. And if you're connected with the real world, you'll get it. Let me give you one example. We're doing a course in the Cook County Department of Public Health, just a course for all of our staff about public health. And we were talking about communities that were serviced by banks, by real banks, which means you could have a bank account, it was insured, you could get a loan, you could get a home improvement loan, and people who were serviced by currency exchanges, okay? Which means you don't do nothing, you have to pay them to cash your check. So in our class are just ordinary Chicagoans living in this case, on the South Side. And they said, you know what? I never understood 109. When you drive from east to west, there are no banks, it's only currency exchange until Cicero. And then after Cicero, it's, so once you begin to understand these structural connections yourself and understand how the systems work, when you point them out to people and it makes sense in their worldview, and they say, oh, I never thought of that way. I never realized that. That's when you begin to make some progress and gain some allies.
Thank you. That was great. So how do you deal with the burnout associated with the advocacy for change regarding all these issues? Sounds like a lot of energy.
Okay, so I'm going to give you two answers. Y'all work with me now. I can't see everybody, but I know a bunch of you all got a grandmother that looks like me, right? So I'm going to tell you what my grandmother and my great-grandmother told me. Baby, you too young to get tired. So okay, that's the cultural answer. But then let me be more serious. Some people don't. So when I was young, burnout is real, and there are things you can do to minimize it. But some people have more privilege than others. So if you got 3 kids and you're a single parent and you're working at a minimum wage job, you don't have a lot of luxury. Okay. You got to get up and go to work no matter what. You can't be saying I'm burned out. So I think the way to deal with burnout is not to be individualistically focused, to fight for things like better schools or good daycare that actually help people in a situation like that single mother might be in, but also to be clear that your strength comes from other people. So some people get their strength from going to church and relating to that church community. Other people have fraternities and sororities or other kinds of clubs, PTAs. You have to build around you, I think, several communities, not just the professional community. So join your professional organizations. And if you don't like what they're doing, form a little caucus in it and make it and change it. But you need to work with groups of people, whether they're fellow students or fellow faculty or fellow people in your church or on your block. And when you have 3 or 4 of those sort of groups around you, you'll find that it's easier to address burnout because you'll have different people who will understand parts of your burnout. When your kids are driving you crazy, if you have teenagers, just hang on. They'll stop being teenagers eventually. I don't have a solution for that, but so you have to surround yourself with other people. That's how we get our strength and our dedication. And my great-grandmother always told me, white folks are always going to knock you down. And the only thing you have to decide is how often you're going to stand up. So that's sort of my attitude about oppression. Oppression is there. It's not going anywhere. And what you have to decide is how you're going to fight the oppression.
That's great advice. But the burnout is definitely real, I'm sure, for a lot of folks on this call.
It is real, and especially now. And so, and let me just say, most people on this call probably have some access to behavioral health services. I think those should be used. I have a serious approach toward those. But in addition to that sort of professional help, including medications, I think the most important thing is having a support system of human beings around you. And you don't need just one, you need several different support systems. When I was younger, I used to say I had a half a dozen mothers. I mean, I love my own mother a great deal, but I made sure that I had a half a dozen mothers around me because I was too much for one, one mother can't do it, So, and that's what you need. You need a whole bunch of people around you representing different interests and groupings. And it takes work. That means you have to work on building those relationships, and it's hard right now in the crazy Zoom world we're in. So,
yeah, absolutely. So maybe our last question here: with your experience in the healthcare system and with the new administration coming in, what would you say is the most important first step our new government could do to start reforming the system?
Well, I already said the first. I know they're not going to do it, but the first most important thing they could do is to pass Medicare for all. But we know Biden is against that. This is what I think they have to do, and this is what I think you all have to do, because I'm more interested in what you all are going to do, not what they're going to do. We have to articulate clearly what we need. We need a guaranteed basic income. Okay. If you want to address poverty, we can't continue to enact things that we know won't solve the problem. We may not be able to solve the problem in one administration. We know we're not going to. So we have right now in our country, this is my personal political analysis. We have a Democratic Party that is not progressive. Let me be clear about that. It's not a progressive party. Biden, as he said during the summer, he won, he defeated the progressives, okay? And we have people in America that they may not support Trump, but all those values that Kamara talked about at the end, the individually, they believe in those values. They believe in American exceptionalism. They don't believe that we have a country built on white supremacy. They believe white supremacists are just a few people that weren't nice and may still be around. They don't understand that that's baked into the structure of the country. And so to me, the most important thing we can do is stay in the streets, stay fighting for what we think we need, a minimum wage. And we should be careful, like a minimum wage of 15 is already too little. We should get rid of that. We should say a minimum wage that allows people to live at a certain level and that's tied to inflation and changes like that, okay? And we can say it simply. A retirement, Sir Michael Miramont had this approach. He said, when people retire, they should have enough to live comfortably And he said, and what does that mean in English? They shouldn't have to worry about food, clothing, shelter. They should be able to take a vacation at least once a year, and they should be able to buy their grandbabies Christmas presents. So, that's sort of like a plain English definition of a good return. And if Social Security doesn't do that, it's not good enough. Okay. So I think we just have to say what people need as human beings and work to find other people who agree with that and move to change that. And that's not going to happen with the present Democratic Party, in my opinion. It's not going to happen quickly, but it won't happen at all if we don't start to work on it.
Absolutely. Well, thank you, Dr. Murray, for your talk. Sounds like folks are very happy to have heard you in the chat. So we thank you for just giving us your time, answering our questions. So now we are going to go to a break. So those who are registered students, please stay. We're going to go over the syllabus and the assignments. The rest of you all, thank you for joining us. We hope to see you in future sessions. All the RSVPs are open. So feel free to take a look at the schedule and RSVP, and hopefully we'll see you soon.
Great, take care.
All right, thank you. So those who are students, we're going to take about a 10-minute break so you can stretch your legs, go to the bathroom, get some water. So we'll be back here at right at 7 at the dot. 7 on the dot. All right, folks, let us regather. And you should be able to unmute yourselves now that it's a smaller group if you'd like. So this portion of the course is still going to be recorded and just posted to Blackboard. So the students who weren't able to join live can watch it back and be in the loop about the discussion. But this portion will not be posted on the public course website, just to let folks know. So I will go ahead and share my screen. So we're gonna start talking about the syllabus and then hopefully answer all of your questions about any assignments or the structure of the course. And if we have time, we can go around and do introductions. It's great to see so many people with cameras on because I feel like in so many meetings, I don't really see many faces. So I will go ahead and share the syllabus here. Okay. Folks can see this? Great. All right. Washika, do you want to kick it off?
Yes. Hi, everyone. It's Miss Torres. That's just what I go by. It's easier. And so I'm going to go over the course description for the syllabus. One moment. Sorry. So this is a 2-credit course, and it was developed. It's a collaboration between members of the Radical Public Health, which was spoken about earlier, school public health graduate students and faculty who came together in about 2018 and wanted to address issues around democracy, social justice, and public health, and how those kind of work with or against each other. So there are, a lot of issues around reactionary politics and policies that will just result in unjust circumstances, have a long history in the United States, as Dr. Murray spoke about, and they're resurging today in a way that more people are aware about, and more people, because they're more aware, they can do more things. So to kind of eschew the issues around ahistorical conversations around public health, this class is a historical, social, cultural, and political kind of facets related to historical, contemporary health. I know we had a question about how do these things relate to health, and there was a book about medical racism that was mentioned in the comments to kind of get a better idea of how racism affects medicine and medical health, especially for marginalized people. And so we try to have this very interdisciplinary approach to understanding public health and cross-movement work. So what movements around race, gender, class, immigration, and what impacts do those movements have on public health and public health information? So we're going to be exploring these, we call them legacies, and learn how today, like in the present, we can look at advocacy, the advocacy we can do now, and look at how that's a history of advocacy, just like when Dr. Murray mentioned Kent State and then mentioned her granddaughter at protests. How do these legacies and works of advocacy connect, and how do we use the knowledge we gain from this class through lectures, labs, interactions with the community, with each other, to gain these skills? How do we engage in these different types? And it's not just legislative advocacy, all different types of advocacy are valid here. So what we want you all to be able to do by the end of the class, and I'm sorry, so I actually hold my office hours right before class from 4 to 5 on Blackboard Collaborate, and Mrs. Grant holds her office hours on Tuesdays from 9 to 10. If these don't work, just email one or both of us and we can work something out around our own schedules. So we want y'all to be able to describe and understand the theoretical basis and the importance of human physical embodiment in regards to history and its relation to public health and health inequities. Articulate the importance of history, law, policy, power structures, oppressed and oppression, to understand and protect the health of the public. So how do we move from just saying, oh, this is what this effect has, but how do we become active in that? Describe key historical, social, cultural, political factors related to historical and contemporary health, well-being of different groups from both advantaged and marginalized groups. evaluate ways in which power structures and systems of oppression throughout history have shaped these current, but also historical and also current social injustices and health inequities. Look at history and contemporary resistance to these systems of oppression along various areas of health among different population groups, and how do, from those understandings, how do you understand those, incorporate those, and take that knowledge out with you through your academic work, through your work as professionals, and as global citizens.
Thank you, Ms. Torres. So as folks might have seen on the top part of the syllabus, we don't have a set list. We don't want to like bombard you with all the readings because it is a lot, as I'm sure you might have experienced from this week's readings, especially those who are maybe not coming from public health, or even those in public health who haven't had this kind of content before. We realize that it can be a lot of new information, as we learned from Dr. Murray today. So we will be posting about 3 or 4 articles to read each week. And we've tried to select those knowing that not everyone comes from public health, and trying to select materials that are digestible, but also provide that, that meaty content that we really hate, right? So we've matched the readings for each week with the topic of the speaker, as well as the advocacy strategy or resistance, form of resistance that each week's topic is going to focus on. So this is our lineup, which I'm sure you've seen already, both here in the syllabus as well as on that public site. So one of the ways we've structured this course is that the action labs will be primarily just for you guys to really get the hands-on of learning the skills of what does it look like to put public health and action together. So those action labs will be smaller group, really activity-based, rather than sit down and listen to someone talk for an hour. And we hope that that will be an experience for you guys to be putting together all the different pieces of everything that you're learning, and also having the opportunity to connect that with the work that you're already doing or hoping to do. So for each of the public lecture sections, we are going to do kind of similarly like we have done today. So our plan is around 6:45 to break, and folks who are not registered can draw. Class period is for us to talk about the readings, to talk about what folks posted on the discussion board, to ask questions. For some of the weeks, the speakers will be able to stay on, so you'll have a kind of more personal time with the speakers. So each week you guys have even extra opportunity to interact and discuss with each other. Are there any questions about the layout of the course so far before we talk about all the assignments? Okay, sounds good to me.
Oh, I'm sorry. Real quick, this is Randy speaking. The courses, they're being recorded. Does that mean we're not required to attend some of them, or what's the required attendance for the courses?
Yeah, great question. Yeah, thanks for that, Randy. Yeah, so our preference, I think, as instructors is as often as you can, or as much as you can, attending live, I think, is the way that you'll get the most out of this course, and be able to ask questions to the presenters and also engage in this discussion after the presenters. But we are recording all these sessions, knowing that just in the time and space that we live in right now, it might not be possible to attend each session at the set time. So all this will be recorded, and attendance at the live session is not part of your grade. So hopefully that helps. Yes, this is a great question. And so we've kind of structured the grading. What is within the participation portion is really focused on what you do outside of this session, and asking questions on Blackboard. So we have a thread set up for each week for you to ask questions or add a comment or thoughtful something about the readings to just show that you've done the readings, or you read the lecture, you're engaging with the content, and also engaging with your peers. So feel free to post something every week, read through what your peers post, and make comments, engage in discussions. I know it's definitely hard to stay engaged, and also exhausting to stay engaged, especially if you're taking multiple courses. So we wanted to create multiple ways for you to do that. So whether that's attending and participating mostly in these discussions after the lecture, or posting in Blackboard, whatever you prefer and whatever works best for your schedule and just the way your life is right now, we want to accommodate for that. And so our participation grade is really based on what you put out and not necessarily attendance. Amy asked, is it okay to use chat for the discussions? Oh yeah, your microphone. Yes, that's fine. You can post any questions you have in the chat. I see Amy Bailey has her hand raised.
Yeah, thank you. I've got a question. I was not clear when I logged in for the class today. It looked like there was a different format for logging in for the action labs, and I didn't know what that was, how we should access those.
Yeah, good question. So the action labs, we may change the format a little bit from today, just based on our lessons learned from the waiting room process. But the plan is for the action labs that will be kind of the similar process. So we will have the waiting room set up. Like I mentioned, we're trying to limit that basically for you guys. So we'll have to be looking for you guys in the waiting room to make sure that you guys are the ones who get let in. So there's a lot of people interested in the course. So that's something we're kind of troubleshooting and working with, but it will be similar to today. Hopefully faster than it was today.
Thank you.
Hi, I was trying, I didn't know how to raise my hand. I saw Amy was able to, but I don't have the little feature at the bottom. My name is LaShonda. As far as the discussion, so, I do understand to make the initial post, but if we don't do the response on the actual discussion board, but we are participating in the after lecture part, is that okay? Because, sometimes I may not go back and interact as much on the discussion board, but I'm always actively engaged in discussions during class time. So is that an option as well?
Yes.
Okay.
Yeah.
I just wanted to clarify that.
Ms. Torres, feel free to chime in. Yes, so our plan is to kind of pay attention to who talks during class like we would in person, but also discussion boards as well. So it's not like a strict, you have to do all of these things, but we just want to see that you all are engaged, whether or not we see you here or online.
Yeah, we like Mrs. Grant said, and there's different ways to engage. We recognize that some aspects of engagement may not be accessible for some people. So with one class, some students did discussion board, or they did videos. I chose to do videos. It was just easier for me to verbally explain what I meant, or verbally explain images rather than typing them out. But some people, it's easier to type and edit their thoughts. So whichever way you feel more comfortable, that is most accessible to you to participate, is the way that you should participate. So we will all be checking the boards, we'll be checking in with the groups to make sure, because we just want people to make sure that they're participating, they're engaging, that they're adding to the conversation and also getting something out of the conversation. That's what the most important aspect of the participation section is.
Yes. And again, we realize what the world is right now. So there's grace, I will say. So someone asked, are those discussion board posts due a certain day? So we have preferably posting it before class on Thursday. So we didn't make it required today because we opened everything on Monday. So for next week, having whatever reflections you have about the readings, you can post those before class. And then if you attend the session, you can join in on the discussion after the lecture as well. So to clarify, no reflection due tomorrow. Next reflection will be over next week's session. So we will have a reflection due tomorrow, which I'll explain now. So after each session, we do have a reflection assignment, just a 1 page. So very, very short, but something thoughtful to, again, show that you've engaged with the content, you've thought about the content. And a lot of you all in your introductions, I saw that you're hoping to apply this in the work you're doing, in the research, in the future work you want to do. So I'm actually excited to read your journal entries and see how this content is making you think about what you're already doing. So the reflections will be due before the next session. So this week's reflection will be due next Thursday. So you'll have a whole week to do it. You can decide if you want to do it tonight while everything's fresh, or if you want to do it tomorrow or over the weekend or next week, whenever works. And we will be opening all of the weekly activities and readings every Friday. It's on a timer. So the folder will be made available, and we won't be, once that's available, we won't be adding or taking away any materials. So we wanted to make sure not to post things with all of our guest speakers and then be changing them around for you all. So the reflections, it's really, the structure is pretty flexible. We put some guiding questions here in the syllabus, but you don't have to follow those strictly for your grade. Your grade on the reflections is really just based on, did you do it? Is it thoughtful? Did you pay attention to the content? How is it applicable to you? Again, this course is really focused on putting together public health action, advocacy, and getting you all to think about these things. And so whatever that looks like for you personally, that's what we're really interested in seeing.
And for instance, if some of you don't want to write, you want to speak, we can talk about alternative guidelines. And if you need any kind of, just, go through the site. If you need any accommodations, please send us letters of accommodations or any kind of, even if you don't have an official letter, things that will help you to do what you need to do so we can make the class accessible in multiple formats, because some people learn differently. Some people are better at visual, some people are better at auditory. So just let us know how we can make sure the class is benefits you, you can get the most out of it. So making it as accessible as possible will ensure that everyone gets as much information as they can out of it. And again, if you have any issues that come up, just feel free to email one of us. If you can't go to our, one second. I think that might be a question for Mrs. Grant, because I don't use Panopto. But yeah, so if you, or like say you want to have a private YouTube channel, I've had students send me links to responses via private YouTube channel, just sending me the private link, and then I would view it and grade it and give feedback via email. But just let us know so that we can have a charted plan for everyone, so that we don't have any kind of hiccups or issues as the semester goes on. And if Blackboard has any issues, we have alternatives built in place for everyone.
Yes. Okay, so Rucha, hopefully I said that right, Arusha. Will the lectures discussion be available right after class? Our goal is to have them posted Friday. Kelsey is our superstar of posting things. So if folks have issues accessing anything or questions about accessing the recording, if there's any issues, Kelsey will be the best first course of action, but our goal is to get those posted on Friday, so you all don't have to wait a long time to engage with that content. A question, is there an option to submit reflections via Panopto? I believe so. I need to figure out how to set it up, but why not? And yeah, okay, so the journal reflection for this week is due by Wednesday, yes, by next week. And I will, for clarification, maybe I'll put into each week folder the dates of all of those for each week, if that will help folks. Okay, I see head nods. Okay, great. So I will do that for future weeks coming, and I'll add that to our week 1 folder with all the dates, so we can stay on top of it. Okay, so next part of your grade is an engagement activity. And this is just our our encouragement to you to engage with content related to this that's outside of the course, because there are so many great talks, I'm sure, going on at UIC, outside of UIC, especially in the time that we are in. And so for that, it is just attending an engagement activity. We have some examples of that. It could be a lecture, a workshop, a panel discussion. It could be, it could even be like a protest or event. And we have a thread on the discussion board for events. So I already posted a couple that are coming up next week. And Radical Public Health has events happening this semester. So there's a variety of different events, and you don't need our explicit approval to use it as your engagement activity. If you think that it relates to the course, it relates to the content, feel free to put that in that discussion thread and share it with your peers, all those different opportunities. So each week you will have a set of readings to do. We'll be posting the speaker bios. Before Thursday, those discussion boards will be open for you to drop discussion points or questions from the readings. And then the journal entry will be due over that following week before the next lecture.
Hey, Randy, again, real quick. I just want to make sure. So it's required to post a discussion board post before class as part of your participation grade?
So it would be either something on the discussion board, or it could be something like engaging in the actual session. So it's not a strict requirement.
So for instance, if you know you can't make it to the actual discussion that week, you can post your thoughts about the readings in the discussion board, like, oh, hi, I can't make it, but these are some things I'd like us to think about or like people to talk about. So LaShonda had asked, so the reflections are yes required. The discussion board is highly recommended. It also helps you gather your thoughts beforehand as well, so that discussion can flow a little easier. You can think out your thoughts and write them down or record them or something like that. So yeah, so the reflections are due every week. This week, the reflections due Wednesday because it's the first week of class, but generally they'll be due the Friday after class, except on certain days, which are mentioned there. But so the discussion boards are highly recommended, especially if you can't make it to the class sessions, but the reflections are required.
Hopefully it helps.
So we have a little bit of flexibility as opposed to for the formatting of a discussion. Like you said, like we just talk about our thoughts, like, hey, I read this and I was just a couple of things that just, it's not like a specific format like the reflection is, right? Is that
right?
Yes. Okay. Okay, good.
Yeah, so the discussion board could be like 2 sentences, like, this is my favorite reading, I never thought about this before, here's what I learned. So it doesn't have to be an essay, hopefully not mentally taxing. Yeah, just something that came out of it. If there are any questions raised, if there's anything you're curious to hear about the speaker to talk about, kind of your reflections on going into the class.
Also, if there are things we didn't understand, maybe we can answer them in discussion, or your peers can. That's also really great when, maybe if you don't understand, what does this word mean? Why is this important to understand? I know we had some questions when Dr. Murray was speaking. And because of that, that would be a great thing. Oh, I don't understand how this relates to this. Another student or one of us can answer that, so.
Yeah, absolutely. Someone asked, does the critical conversation with Dr. Kendi happening count for the engagement assignment? Yes, it does. And I am co-moderating it. So I'm very excited. So if you're free, that is next Wednesday at 4. Okay, so moving on, we got a couple minutes left here. Try not to hold you guys even longer. So for your midterm assignment, it's a book report. So as you may have seen on the syllabus, we have a link to a Google Doc with recommended books. And after class, we're going to make sure that A lot of the things that Dr. Murray suggested are on there, as well as the books that were added in the chat. So we're working on adding to that list. And we have a thread on the discussion board to share what book you're interested in reading or what topic you're interested in reading. We really encourage you guys to read together in a small group, even if it's just 2 of you. And then we're going to take kind of take a breather after spring break to recenter ourselves in all of the content, because all the sessions will be kind of like today, like a bombardment of information. And so we're going to take that class to really stop and reflect on the semester so far, as well as to talk about our books. So please engage with that discussion board, and feel free to email us if you have questions about what book, if there's a book not on the list, if you're interested in reading that. More often than not, the answer is probably yes, if it's related to public health or justice, or organizing. We are relatively flexible on what the book is focused on. Jessica asked, can we add or share activities in the engagement thread? Yes. So if you have events that you come across, they don't have to be at UIC. If there are any events you hear of or opportunities you hear of that would be good for this assignment, feel free to put that in the discussion thread. There are a lot of great things happening, and it's hard to stay on top of all of them. All right, last piece, our final assignment is to do a project that engages with the content of the course, something that is a piece of work that integrates a specific advocacy tool. So each week we'll be going over various different tools. So we're going to talk about policy briefs. We're going to talk about art as activism. We're going to talk about even facilitation. So if you want to make a facilitation guide as your final project, that's fine. There's a lot of flexibility in what that format can be. And your grade will be broken down into the assignment itself, as well as thoughtful comments on your peers' assignments. Amy Bailey asked an op-ed. Yes. Yeah, so we are very, we encourage you to do a project that is most useful to you and your work. Something that you could even put out, like you can make a TikTok video about medical racism as your final project if you'd like to. And so we encourage you to do something that feels meaningful to you and engaging, tying together the content of this course. And so that's something to just kind of think about as we go through the course. And then I'll be due the last week of class. And as Ms. Torres said, if you have any needs, any questions, any way that we can help you engage in this course better, please let us know. Please email us. Feel free to drop into our office hours. We want to make this class hopefully as pleasant as possible. I know 2 hours sitting in front of a computer is a long time. So we really want to see you guys engage, hopefully the whole semester. Rusha asked, final assignments are individual. Yes. Although I think there's this, if there are people who are interested in doing a group assignment, that's something we can certainly talk about.
Just FYI, if it is a group assignment, then it still has to have the kind of extra rigor than if it was just one person. So you can't make a TikTok video, one small TikTok video with all 5 of you, something like that. So it would still have to have, it would have to be more than just what one person could do. So just an FYI for that. So generally they are individual, but if you want to collaborate, let us know. If you struggle with some ideas, we can help. There are some things that are happening in the world right now, some projects, campaigns, grants, policy things that people can ask us about. We try, I mean, the whole point of the class is to keep abreast of things that are happening contemporarily. So for the most part, we have those ideas. You have ideas you want to share with others, please do that. This is a collaborative process, purposefully.
Yes. Does anyone else have any other questions? I know this course is probably different from others that you've taken. If not, I will let you go. It is 7:30. Feel free to, I can hang back for a couple minutes if folks had any questions, comments, concerns. I'm excited to see you all this semester. And we will post all the materials from this evening on Blackboard, so that'll be available tomorrow morning.
Yeah. And I'll also hang back for about 15 minutes or so, or however long people are still on, to answer any kind of questions or anything like that.
Thank you, everyone.
Thank you. Have a good night.
Thank you. Bye.
Thanks. Bye.
Thank you.